Imagine trying to predict something really unpredictable, like a disease outbreak. It feels a bit like staring into fog, doesn't it?
Totally.
But what if there was a way to, cut through some of that fog, see warning signs maybe days or even weeks before things get officially bad?
That's exactly the promise. The really exciting part of this area right now, using things like AI, machine learning, and, well, all that digital data we leave behind.
Every day.
Social media posts, what you search for online, even like online reviews. The core idea is turning these sort of digital breadcrumbs into an early warning system for public health.
And that's precisely what we're digging into in this deep dive. We've pulled together a whole stack of sources, research papers, articles, some reviews, covering the potential, which sounds amazing, but also the very real challenges, and crucially, the ethical questions, especially when you start talking about digital surveillance for diseases.
Yeah, and our mission here is pretty clear. Let's try to unpack what these sources are telling us about this rapidly evolving frontier, trying to get ahead of outbreaks.
Okay, let's unpack it then. So how does my social media feed or my search history actually tell us where the next flu season might hit hardest, or where some new virus is starting? How does that leap happen from my keyboard to a public health alert?
It does sound a bit counterintuitive, doesn't it? But the key insight is this. People often feel sick, or they worry they're sick, and they go online way before they step into a doctor's office.
Right, before they become an official statistic.
Exactly. Before you're a case in the system, you might, tweet about feeling achy, or search Google for symptoms of X, or look up home remedies. You leave this trail.
An informal signal trail before the formal healthcare data kicks in.
Precisely. And the sources we looked at point to all sorts of these informal digital streams being explored. Social media, obviously Twitter was a big early one for analysis. Then search query data, what millions are typing into Google, Bing, even Wikipedia searches. But it goes even further, like you mentioned earlier, review websites.
Review websites. Seriously. Like reviewing a restaurant. How does that connect to getting sick?
Yeah, it's pretty clever, actually. One source talked about examples where review data is being used in a similar way to social media.
Okay.
Like Yelp worked with the LA County Department of Public Health. They were basically using restaurant reviews to spot potential foodborne illness clusters, stuff that might not get reported officially right away.
I see. People complaining, I ate there and got sick.
Exactly. And the NYC Health Department did something similar, scanning reviews for mentions of sickness after eating out. It's about grabbing that real-time, informal feedback on potential health issues.
Okay, so you've got this fire hose of informal data coming in, tweet searches, reviews. That must be where the AI and machine learning come in, right? No human can read all that.
Absolutely not. This is where machine learning algorithms are just essential. They're built to process these absolutely huge, often really messy, unstructured data sets. Like
just raw text.
Raw text from tweets, search terms, yeah. And they find patterns that, honestly, a human analyst would just completely miss. They're not given rigid rules like find the word flu. Instead, they learn from the data.
How does that work? The learning part.
They might spot correlations between certain, maybe unusual phrases people are using, or patterns in search activity, or geographic clusters that historically came before a known outbreak. They learn what combination of digital signals tends to point towards rising illness.
Can we talk specifics? Any examples jump out from the sources? I remember hearing a lot about Google flu trends way back when.
Oh, yeah. Google Flu Trends is kind of the classic early example, using search queries to try and predict flu levels. It really showed the potential, got a lot of attention.
But didn't it have problems?
It did, and that's also why it's famous. It famously overestimated flu cases sometimes, quite significantly. Eventually, they stopped publishing the predictions publicly. It's a really important part of the story because it shows this isn't easy. Not a silver bullet.
So not perfect, but it kind of proved the concept was worth chasing down.
Exactly right. And the sources show how researchers have definitely built on that initial idea. We see examples using social media language analysis, not just for outbreaks, but even identifying patterns linked to mental health conditions. Depression, for example.
Interesting. So the language itself holds clues.
It seems to. And for infectious diseases, studies are using more sophisticated AI now. Things like recurrent neural networks, RNNs. They're good at spotting patterns and sequences, like trends over time.
Okay.
And they're combining things like mobility data, where people are moving, with social media data to predict, say, COVID-19 trajectories in certain areas.
That makes sense. Mobility data showing potential spread combined with what people are actually saying online.
Right. And there's other work, too, predicting dengue outbreaks using machine learning fed with environmental data like weather patterns alongside the usual health data.
Wow.
And, one source mentioned this specific challenge during the MERS outbreak in South Korea. They were using search data, but the problem was the words people used to search for MERS symptoms kept changing.
As people learned more.
Exactly. As public awareness grew, the search terms evolved. So the algorithms had to constantly adapt to these shifting keywords. It really highlights how dynamic everyday language is compared to, fixed medical terms.
What strikes me here, the really impactful thing, is the potential speed, isn't it? Traditional surveillance, it relies on doctors diagnosing, labs confirming, data moving up the chain. That all takes time. Days, maybe weeks sometimes.
That's the core so what here. The promise, highlighted again and again in our sources, is getting an earlier signal, even if it's just a few days.
A few days could make a huge difference.
It could. If you can spot an uptick in symptom chatter or relevant searches before those cases hit the official stats, public health folks gain precious time. Time to maybe issue warnings, get hospitals ready, maybe target resources like testing or vaccines to an emerging hotspot faster. It's about shifting from just reacting
To being more proactive.
Exactly. Proactive intervention.
Oh, okay. But here's where I imagine it gets really interesting and maybe complicated. That potential is huge, yes. But the sources must also highlight some pretty big challenges, right? You mentioned ethics earlier.
Oh, absolutely. It comes up again and again. We looked at one source, a systematic review, focused entirely on the ethical side of using digital surveillance for diseases, and it flags major concerns. At the individual level, organizational, even societal, these aren't just abstract worries, they're real hurdles.
So what are some of those main ethical tripwires they identified?
Well, privacy and confidentiality are right there at the top. Obvious maybe, but critical. When you analyze social media, search data, even if you try to anonymize it,
So personal stuff.
it's still potentially sensitive information. It can reveal a lot, possible health status, location, maybe even who people interact with. There's always a risk of re-identification, someone figuring out who is who, especially if these big databases get hacked.
Right.
And the source even brought up worries about how the data might be misused if it gets into the wrong hands, maybe sold to, say, pharmaceutical companies or insurance companies.
Oof. Yeah, that immediately makes you think about trust, doesn't it? If people feel their data is being used in ways they never agreed to or that it isn't secure, surely that damages trust in public health itself.
It absolutely would. And the review points to that. A lack of clear legal rules and not enough privacy protection are big factors eroding public trust. Then there are concerns about civil rights, autonomy, that feeling of being watched.
Surveillance, basically.
Yeah, which can feel worse if there's no transparency about how the data is gathered and used or if the governance is murky.
And what about fairness? Bias. If you're relying on who's online, doesn't that skew things?
That's a really, really critical point. Comes up in the ethical review and other sources, too. The digital divide is a huge concern.
People without internet access or who don't use social media.
Exactly. If certain vulnerable groups or maybe marginalized populations have less access, or if the way they talk online isn't well represented in the data the AI learns from, their health signals might just get missed or underrepresented.
So the system might be blind to outbreaks in those communities.
Potentially, yes. It could lead to biased predictions. You could actually end up making existing health disparities worse, not better, if the system doesn't see everyone equally.
Okay, so huge ethical questions. Are there also just technical headaches? Trying to combine, tweets, health records, weather data that sounds like trying to mix oil and water?
It's intensely complex. One source really hammered this point, integrating these really diverse, what they call heterogeneous data sources.
Yeah.
Social media text, climate data, maybe electronic health records. It needs incredibly sophisticated pre-processing, standardization. You can clean it all up and get it speaking the same language, basically.
It's like a massive job.
It is. The sheer complexity of just cleaning and combining data from all these different places is still a major technical barrier to building really reliable, widespread systems.
And then there's the AI itself, understanding why it makes a certain prediction, the whole black box problem.
Precisely. Especially with the really complex models like deep learning, deep neural networks. It can be super difficult, sometimes maybe impossible, to really trace back how the algorithm reached a specific conclusion.
Which must be tough for health officials.
Definitely. If you're a public health practitioner, you need to make critical decisions based on these warnings. That black box. It can be a major barrier to trusting it, to actually using it. You need insights you can act on, confidence in the logic, not just, a flashing light on a map.
And going back to Google flu trends, accuracy is obviously key. The sources must talk about the debate around how accurate these things need to be and what happens when they get it wrong.
Oh, for sure. The consequences of being inaccurate are serious. If you overpredict...
and ignore the next warning.
Exactly. Erodes trust. But underpredicting is obviously dangerous, too, missing that chance to intervene early. The consensus in the sources seems pretty clear. Right now, these digital prediction systems, they need to be viewed with caution.
So not a replacement for traditional methods?
Not yet, no. Ideally, they're used as complementary tools, providing extra signals, another layer of information, but not replacing the established surveillance systems entirely.
Okay. So if we sort of pull back and connect this to the bigger picture, applying AI to these digital footprints isn't just about predicting outbreaks, is it? These methods seem broader.
They definitely are. And yeah, our sources touched on some related areas. It shows how predictive analytics, using all sorts of data, is kind of weaving its way into healthcare more broadly.
Like the review data you mentioned earlier, not just outbreaks.
Right. That Yelp example with LA County or NYC Health using reviews for food poisoning clues. That's the same basic idea, isn't it? Using informal public digital data for public health insights, but beyond just infectious diseases.
And you mentioned a book on AI in healthcare.
Yeah, that source pointed out how predictive analytics are already being used inside hospitals and clinics. Things like predicting a patient's outcome after surgery or figuring out which patients might be at higher risk of falling.
Using their health records.
Primarily, yeah. Using electronic health record data, sometimes trying to integrate data on social determinants of health too. Applying AI to find patterns that predict future health events for individuals. It's different from population-level outbreak prediction, but it's part of that same big trend, using AI and diverse data to try and anticipate health needs and risks.
So wrapping this up, what does it all mean? It feels like there's this real tension. On one side, you've got this incredible potential, using the digital trails we all leave to get a jump on disease outbreaks, a tool that could genuinely save lives.
A huge potential upside. But then on the other side, there's this really intricate web of challenges. Navigating super complex ethical issues, privacy, surveillance, then wrestling with the sheer technical difficulty of integrating messy data, making sure the algorithms are fair, transparent,
And accurate enough.
to be genuinely useful, not confusing or harmful.
It sounds like the digital whispers are out there, hinting at what might be coming. But actually tuning into them effectively requires more than just fancy tech. It needs really thoughtful rules, governance.
And a real commitment to protecting people, focusing on making sure the benefits actually reach everyone fairly.
Yeah. It's clearly a powerful tool in the making, but one that needs to be handled with immense care. As our lives just get more and more digital, we leave more data breadcrumbs with pretty much everything we do online. How do we make sure that using this vast ocean of data for something clearly good, like public health, doesn't accidentally open the door to, pervasive surveillance or come at the cost of our basic privacy and civil liberties? That feels like the really big question hanging over all of this fascinating work.